and I'm here to share with you my experience of the exam FRCPath 2. So I have already made a couple of videos related to FRCPath 2, and this is the continuation of what we were doing previously. So what we were doing basically is I was taking you guys through the exam days, the sections individually. So we did cytology, and then what I'm trying to do is that I'm doing the sections in a way which is as it appears in the exam. All right, so the first day you have these sections, and the second day you have the last three. So I'm going through in that manner. All right, so now second section is frozen section. So we already did cytology, and now we are doing the frozen sections. All right, now you guys know that in the frozen section exam you're going to get six cases. Now in those six cases will be in two sets, so there will be three cases in your first set in your first 20 minutes, and then another three cases in the next 20 minutes. All right, so that's how the exam will be. And how can you prepare yourself for this particular section? You can read books, but there are a lot of books available for frozen section. There are some of them which are very nice, and they give you very good points to differentiate and to know how to avoid the pitfalls and etc. So those books really might help you. There are some amazing lectures by, again, Dr. Ali. I am absolute fan of his, and I just like all his material, and they are extremely helpful, right? So if you have been listening to me, you have listened to him, and you know that what I mean by saying that he really tells everything in so much detail. His frozen section lectures are also one of the you cannot miss ones. Okay, you cannot just miss it, because it is so amazing and so helpful for the exam day, right? Apart from those lectures which are he basically uh, gives examples and takes you through some of the important ones or some of the most common ones, but there are other series like the Cap Watcher lecture series, which has some general topics for frozen sections, right? So if you need a like basic idea, or if you want to clear some doubts or something like that, those are also helpful, right? But Dr. Ali lectures, I think for frozen section exams, you really have to listen to them before going and sitting in the exam. Now what you can do is, when you read the books and when you read all these lectures, you can start making your own notes. All right, when you make your notes, I think that is really helpful, because you will get gaps in between your exams, right? You will get a lunch break, and in the first day of the exam you might get even a very big lunch break, because there will be people who will start the cytology exams at 9 o'clock, and then there will be people who will start the cytology exam at 10:30 or 10:40, right? So if you're in the first batch, you're starting your exam at 9 o'clock, then you finish off early your sections, and then you have a lot of time um, to revise, right? Instead of wasting, I think it's just good to revise things that time. And even if you're starting at 10:30, you still have in the morning time, which you have sufficient time which you can use it for revising. So you might always get time to revise and go back to your notes. If you are that kind of a person, I am. So that's why I'm suggesting you that if you are the kind of person who likes to go through your notes and maybe see one or two points till the end, then you can do this. You should make your notes, okay? And it is also very helpful in the last days of the exam, before the exam. The last 14 days, I think you just do not have time to go through everything. If you have your notes in place, it's really you can revise it again, and your notes has those things which you tend to forget, or you tend to not know. So make sure that your notes only has those things which you do not know, right? With the things that you know, which is like a basic knowledge for you, you don't have to write them. So if you revise them, then your memory, your entire thing becomes really fresh, and I think it's really helpful for the last 14 days and for the exam days. So please make your notes for each section, I would say, if that is possible for you, so that just before the exam, just before that section, you can just go through those notes. Try to make it as minimum as possible, not more than 10 pages if possible, right? Mine goes into hundreds, but I would suggest do not make it in more than 10 or whatever, right? Because I write a lot of notes. I have already written a book basically. So anyway, but make your notes, gather all the points that you get from all these lectures, and put that down into your notes, right, from the books and from the lectures. But of course, especially for the frozen section, you need to see the slides. Now, why do I say if possible? Because there'll be a lot of centers which will not be doing frozen sections, but for your exam, you have to clear the section, and you have to see slides. Now, it is best if you do not if the exam slides are not the first slides that you're seeing, right? Hopefully all of us have seen frozen section slides. Even if you have not, just try to get it from somewhere. Usually they are not so well maintained or preserved, and so not many people will have boxes or collections of frozen section slides. But even if you see some, if you're lucky, you are in a place where you are doing frozen sections every day and you basically are very familiar with it. But if you are not, you just try to get the hang of it, because there will be things which are in the fresh tissue, they look different. Everything looks big, right? If you are not very used to it, you might find everything as positive, right? You might find everything malignant and positive. Even the lymphocytes, they start to look very bad. So what you need to do is you need to make sure that you know exactly the dimensions and the things, and get the hang of it, basically, to know how exactly things look when they're in fresh state, and so that you do not confuse the positive from the negative, right? And one thing which I really feel is helpful is that you start looking from the lowest power, right? Do not jump to high power on frozen section. It is disaster, right? Do not do that. Never do that, even in your real life and even in your exam, because everything is going to be blown up. They will all look big and ugly, and you're going to call everything as positive, right? uh, Try to keep things in perspective, like what you're seeing, where you're seeing, what you usually see here, and then and do not, I think best to avoid 40x at completely. Maximum you can go is to 20x or 10x if you want to, but try to stick to 4x and 2x, right? That's the best way you can probably get your diagnosis correct. Okay, now you need to know the scope of the exam, like what are the things that they want to really ask, what are the organs or sections, systems which they usually ask. You need to know that. Some of them are exam favorites, so you need to know that, and then accordingly you need to be better at those, right? But the most common, like in daily life, what the common ones are common in the exam as well. So like we get margins in your daily lives, you get margins in exam, but the margins of like a big specimen, or like a head and neck specimen, is much easier. According to me, or in my experience, it is easier to interpret. But the margins for small specimens, right, or very thin, what do you call it, not thin but small, um, like a bile duct margin, right? A very small specimen, but you have to see all the layers. You cannot miss anything on that slide, right? So things like that become very difficult, like bile duct margin or a CV cut margin or something, some pancreatic duct cut margin, and those are the ones that are which are tricky, and yeah, that's the way you have to focus more, and you have to be sure what you're giving is correct, right? Because these margins also have big consequences, even in real life, right? For your exam, of course, yes, calling something positive and negative is going to make you fail or pass, and there are only 6 cases, so you don't have a margin. You can at the most you can make one mistake, right? You cannot make more than one mistake in the exam. And for your real life, it's going to have a big implication whatever you say on the frozen section. Otherwise, and if you do not give a correct answer, then what is the point of doing a frozen section, right? Then they should not trust you for frozen sections at all. So you need to be thorough with how things are and what are the implications. Okay, you also need to know the implications of your answers, because this is a question which they might ask, right? Sometimes they might ask you, like, what do you think if you say this, what is going to happen, right? What will be the surgery, what will they do next? So you need to know whatever you are saying, what is the implication of it. What does it mean for the patient if you say this and that, right? So this is a viva exam. You don't really have to write too much, but this is a viva exam, so they can ask you questions related to it, right? So you need to know those things. And also, because it's a viva exam, you can start speaking sentences to answer, if that is something which you think you need practice of. If you think you're a pro at speaking and you don't have to really think about it, or if you've already done too many frozen section conversations with your surgeons and everybody, then I don't think you really have to worry about that. But maybe in case you don't want to have that kind of exposure, you might want to start speaking or making sentences to answer, because you don't have to really write anything in this exam section, but you just have to speak. okay, then I'm going to tell you like case one, what did you think? So you start saying about whatever you thought or whatever you saw. Although you have a paper and a pen, you can write down your notes so that you can remember at that time of Viva, like, what did you see actually. But you don't really, they will not check your answer sheet, right? They will just note down whatever you say. Okay, it's a Viva, purely Viva exam. Now, as for the material to study, you have a few books, okay? And I found all these books are very nice and interesting, and they are good. I usually used to, while preparing in the time that you're preparing, I usually used to read at least one chapter or one section before sleeping, right? That was my last thing to do. This was my bedtime story, frozen sections. So yeah, I used to do that every day, so that I'm familiar with it, I'm not forgetting it. And when you start seeing pictures, because these books have a lot of pictures, then there are things which will stick to you. And beneath the pictures there are very concise statements which are the most important statements actually. Okay, so all pictures, if you do not have time ever to read the entire book, just go through the pictures and read down whatever is written beneath in the pictures. Okay, so those will be the most important things, the most important topics, or the most important characteristics, okay, the most important findings which you can see and you can pick up things, right? So do that at least. And also in the on the virtual pathology website, you have a section of frozen sections which comes under the teaching mixed slide collections. You have a frozen section which is not too many slides, but at least it is something, right? It is better than nothing, so it is at least something. So you can start your practice with at least that, and then try to at least get some more slides from wherever you can, and practice them, right? So the exam day, you do not have, as I said, that you do not have to write much. You will have enough time. So 20 minutes is enough time to just to see 3 slides. Okay, and if you are seeing them on 2x, you are not going to take too much time. If you're going to see it on 4x, you're not going to take too much time on one slide. All right, it's going to take you hardly 1 or 2 minutes for one slide. Okay, so you start making your diagnosis then and there, read your histories properly, and see this, give time to your slides. You have sufficient time. Just note down the very important things that you think. Okay, maybe you get 2 diagnoses. If you see 2 things, just write down those 2 things or something like that. You can write it down for your own reference, but they're not going to check it. All right, but you have enough time. Do not hurry. Do not try to go on the 40x. Stay on the low power, and try to scan everything, right? Try to scan everything. You cannot miss anything, because there will be times when there will be a slide which has got a big section, say for example a liver section or a pancreas section, or something big, all right? Or maybe sometimes there will be multiple sections. So those are the slides which will require more time. So give more time to those slides than to those which are very small or very easy or very clear cut or something like that. Now, this is one of the sections where a negative finding, or if you don't find anything, that is also a finding, right? So you do not have to really hunt and keep finding something, and just imagine. You don't have to do that. There may be slides, there may be cases where there will be no finding, and that is okay. That is okay for this exam. Okay, so there may be positive cases, and there will be invariably negative cases as well. I think I already covered this, and yeah. So as I said, that there might be, sometimes there might be multiple bits, sometimes there might be only 2 bits. Say one bit is very big and your focus is completely on that, and you're trying to search everything and you don't get anything. And then if you look at the slide out of your stage, in your hand, and then you see, okay, there was one more bit here, right? So don't do that. I mean, don't miss it. Okay, so there might be a positive finding in that small bit and the entire thing was completely free, right? So they can trick you with such cases. This is, I think, the most common trick that they play for this exam, that you might just miss the thing because the finding is somewhere on the outside, or somewhere away from the main area where you're focusing. So when you take the slide in your hand, just see how many bits, and then go on the stage and make sure you have seen all the bits, no matter how tiny it is. It may be the positive one, it may be the one with the finding, right? And whenever you are seeing any hollow structure like a ureter margin or a CBD margin or something, make sure you have seen all the layers, right, up till the last. You do not have to concentrate or focus, or you don't have to, you cannot say that only the lumen is what I'm going to concentrate on. No, it can be any of the layers, right? It can be anywhere. It can be outside of the main main section, main specimen or whatever, main thing, the main bit. There may be small tiny bits somewhere else. So that is the most important thing that I want you to remember for this exam. Okay, because you have enough time, you can do this. You just have to make sure that you are not missing out on any bit, and just make sure that you're concentrating and correlating it with the history and everything. But history may not actually help you, because yeah, it's not good, because they don't know, right? The people who are giving you, the surgeons, they don't know. That's why they're giving you a frozen section. So history might not help you, but yeah, history, because you should know exactly what you're seeing. So there'll be three cases, right? Do not mix one with the other. See, one is a oral cavity and the other one is cervix, and don't mix one with the other. So in that way you can just correlate and make sure that you're seeing everything correct. But yeah, uh, just focus on the low power and focus on each and every bit, and you'll probably get the answer correct, right? So mostly the answers will be in a positive or a negative fashion. It's positive or negative. You don't have to actually give a diagnosis. Yeah, sometimes there may be more than one answer or diagnosis. Say for example, I got a case where there was a cut margin of the tongue, right? Cut margin of the tongue, known case of squamous cell carcinoma. What do you expect the answer to be? You say it's either positive or negative, right? So the answer was negative. There was no cancer in the margin. So I said that it is negative, but there was an additional finding that it had amyloid in it. Okay, the section had amyloid in it. So now, so that's basically two answers. So the one answer to the surgeon is that, yeah, there is no negative, there is no cancer here, so the margin is clear, it's negative, but there is amyloidosis in this tongue, right? So there may be more than one answer and diagnosis sometimes, right? Which is probably applicable, or yeah, applicable to basically all the cases for this exam. Any case you might just have two diagnoses. That's possible for everything. But what basically you do not have to diagnose things here, right? You just have to, like in cytology, you have to kind of guide the surgeon. Same thing in the exam. You don't really have to diagnose or go behind the diagnosis as such. You just have to guide them. If it's positive, if they have to repeat it, if they can just go ahead with the surgery and finish it off, or if they should take out the lymph nodes, if it's between a sarcoma and a carcinoma. So if it's a sarcoma, they do not have to take out the nodes. If it's a carcinoma, they have to take out the nodes. So things like that, you just have to guide them and right then and there while the operation is on. So that's exactly the same thing that you have to tell to your examiners as well. You are guiding them. Okay, and there will be sometimes there'll be things which will be a guidance, or maybe not a guidance, but things for you to consider. Say for example, if you're seeing something like it's a node and you are seeing tuberculosis in it, or necrosis, or caseation, something like that. So what do you do with the specimen, right? So you're going to send one part to the microbiology department, and you need to take care that everything is being taken care of, like it should not be handled uh, without caution, etc. So those are things which again have some implications, right? And this was actually one of the cases which we got a section of I don't remember what section it was, but it was started with all these caseation, necrosis, all these yeah, granulomas and caseation. So that was the question by the examiners then. What are you going to do in the lab if you get such a case? So that might be one way of their questioning, one direction in which they can take the exam as to how you are going to handle it. And the other one, or the more common one, is what is going to happen with the patient, how you're going to get the surgeon, right? Because they will want to even in real life, if you have seen frozen cases, that's how it happens. They will keep asking you, they will keep asking you for answers, they'll keep asking you for commitment. Tell me what it is, tell me what it is. But if you cannot answer it, you cannot answer it. If you can only say that it is positive and I cannot answer more than that, that's fine. But if you can, you can tell them, right? You can let them know, okay, this is how it is, and then you can do this, right? So sometimes you cannot differentiate between a meds or a primary. So you cannot say that I cannot differentiate between a meds and a primary, although it has implications for the patient, but you cannot do it. That's the limit, right? So you need to know your limits. And even if the examiner tries to push you, they might, tell you, okay, is there any way you can differentiate? Is there any way you can differentiate? You say no. There is no way I can differentiate. You do not have to commit to things which you cannot do, which are beyond your limitation, which are beyond the limitations of the. Because supposing it goes wrong, then who's responsible for it, right? So you are well in your right to say that that's where that's how much I can say at the moment, right? And I cannot say anything more. So sometimes in ovaries, you are not going to, if you're not sampling the entire thing, you cannot say that if it is a completely invasive or borderline. You say at least so and so, whatever you're saying, you say at least borderline. You don't know what you're going to see in the next 15 or 20 slides, which you will see later, right? So you only commit to the things which you are seeing and which you are sure of, and which will not, make you eat your own words later on. Okay, so that happens in real life, and that will happen in the exam as well. So the examiners will try to push you, but you have to remain safe, right? You have to remain safe. You cannot go beyond saying things which you are not sure of, and which you might not be, might be changing after you see the permanent sections or more sections, basically, right? So you might see things, other things there. You cannot tell them right now. There will be things which you will not be able to say. Okay, and one of those things would be, like I said, differentiating between a primary and a mets. You can tell them that yes, I understand completely that this might be required for a surgeon to for the treatment of the patient or whatever, but this is not something which I can say right now, right? This is not something I can only say that yes, this is what is happening. Now if there are hints for something to be said that it is primary, say for example it's a breast, and maybe you're seeing DCIS, you can say that yeah, it might be a hint that it is a primary, because it's it's showing that it's an in situ component and then it's becoming invasive. So you can think of it, but no, then again you never know, right? You cannot be 100% sure about it. It can be anything. So where you don't know or we cannot say, you have to know where your limits are, right? So be cautious of that when you're answering on that day. Now, one more thing or one more way of answering these questions is to defer. Now, that also happens in real life, but even in real life, you cannot defer a lot of cases, because then again, there's no point of doing frozen sections when you're deferring the case, right? They might as well defer it from their side, right? Why should they send it to you and then you defer it? No point. So it's one of those things which you can do as a last resort when you do not know nothing at all about the case, and you have tried to give it time, and you have seen it on all the low power magnifications and everything, but you still cannot make out if it is positive or not. Especially the positive or not cases, I mean, usually you should not try to defer them, because then, as I said, it does not make if it does not make if it's not helping the surgeon at the time of surgery, if they don't know if they have to revise the margin or not, then why did they send it to you, right? So try not to do that. Try your best not to do that. But if in case you are stuck and you just don't know, then maybe you can say that you're going to defer it, right? But you should have a valid reason as to why you're doing it, right? Why are you deferring it? Why do you think that you need to defer it? What are your maybe differentials in your mind or something like that? What do you think? But you should have a valid reason or justification for yourself. But I think that's the last resort. That's just to save yourself. Even you know that, even the examiners know that, right? So do not try to do this, but yet this is one of the methods or one of the ways or one of the answers in which you can try to save yourself, right? I hope nobody gets into that position that you have to defer the cases in the exam, but you might do it once in a while. Okay, so that's just one case out of six that you can do whatever you want to with it. Even if you go wrong or if you defer, that's fine, but not more than that, right? The other all cases have to be correct for this section to be passed. Now, yeah, be cautious in going too far, like I just explained. Don't go too far in your diagnosis or in committing anything, right? Be just very cautious. Whatever you're seeing, clearly, you can say that. And in these cases, a negative finding is also a finding, and you might sometimes get more than one diagnosis. That's all that is correct. All that is fine, but just don't try to be over smart, or don't try to show over. Confidently things like a lot of things, and you are doing some rare diagnosis and frozen section. Nobody wants it, right? And nobody's expecting that from you, so don't do that. Okay, I'm sorry. Yeah, so the next thing, that was about the frozen sections. Now coming to the third um, section, that's the long cases, right? Now long cases, they'll be basically in the exam, there'll be 4 cases of long 4 long cases basically. So you have one full tray for each case, right? Not exactly full, but yeah, a lot of slides, multiple slides for one case, and for each case you get 20 minutes. So that's a lot of time you would think, but there's a lot to write and a lot to see. So it is actually one of, and this is actually one of those sections where you might get some rare things. So and you might get things which you have not seen, which you don't know, or all those things. So I think this is sometimes maybe challenging, and sometimes it may just easy because you might get a hint, because there's so many slides to see, and the history is so long that if you read the history and you see the slides, you might just get the answer quick, right? So it may be a challenging one, may not be, I don't know. I gave this exam twice. One of the times it was very easy, all the cases were very straightforward, but the second time that I gave the exam, the cases were not so nice, not so straightforward, and there are just 4 cases, and you cannot afford to make even one wrong answer, right? And yeah, so the cases were not that great in the second time. So I don't know what to say about this section, but in terms of its difficulty level. So now for preparing part, of course, you don't have to do too much because the basic things will remain the same, right? So, but there are some areas which are exam favorites, like for example, liver, medical kidney, and medical liver cases. Those are favorites. And so out of the four, 90% of the times you're going to get two of them will be, one of them will be liver, one of them will be kidney, and one of them would be a lymphoma. Now that lymphoma can be anywhere in the body, but many times it is a skin lymphoma, right? But again, it can be a Hodgkin's, it can be a non-Hodgkin's, it can be anything, right? So you have to be thorough with lymphomas, you have to be thorough with kidney and everything about it, and liver and everything about it, everything, meaning the common things, and the how to see the stains and how to write, and you should have a lot of points that you have seen them, and you need to have a lot of points in your mind to write them down, because at that moment you will not get points, because none of us, I think, are seeing kidneys and livers and lymphomas so frequently every day. So you need to have a lot of points which you will be writing down. So for that you can make a mnemonic, or you can have it in your mind, just to, because you don't want to waste time in thinking and writing at that time, right? Now, know yourself. What I mean by that is there will be things which will be expected from you. Like I said, there will be things which will be expected from you. Now, I already told you that out of the 4 cases, there will be 3, which will be, one of them will be most probably lymphoma, one of them most probably will be a medical kidney, and one of them will be a liver. But and then the fourth one can be anything, right? Usually, it is something which is based on IHC interpretation, and it is not so difficult to understand. You will get the answer quickly, but what I want you to know is that what is expected from you in this section is that you should be able to interpret, IHC slides very well. So you need to know how IHC slides are interpreted, when you got it positive, when you got it negative. Now, mostly all of us have seen IHC, and we know how they look like, how to call them positive. We know the basic things, that everything that is brown is not positive. You need to know if you're looking for a nuclear positivity or cytoplasmic positivity, you cannot call it positive otherwise, things like that, the basics, right? So all of us know that, and if you don't know it, if at all you don't know it, then you need to work on it, right? And at the exam time, there might still be some cases, like you may have seen a lot of IHC slides, like me, but in the exam case, I got an IgD slide which I have never seen before, and I don't know what it looks like. I don't know if the few cells are showing positivity, if should I call it a positive case or a negative case. Okay, I still don't know the answer. And so in those times, at those moments, I mean, those moments can come up during your exam time, that suddenly a very strange IHC comes in front of you, and if you don't know if a positivity is what you're interpreting, or a negativity is what you're interpreting, or what is it, right? So yeah, sometimes what might help you in such cases is looking at the control part of the slide. So each slide will have a control section, so you can just go slide over and go and see the control, and you might get a little idea at least of how it should be, if it's a cytoplasmic positivity, or a nuclear, or a membrane, or what is happening, or it's positive or negative or whatever. So that might just help you a little bit, but but okay, that's something which is again not in your control, but most of it, the basics and the majority of it, you should know how to see the slides. And I'm hoping that when you're preparing for this exam, you probably are familiar with it. Special stains again for kidney and for liver, you will be given some special stains. Now what happens is that when we start reading and we start making our notes for liver and kidney, what we do is we rely on all the special stains, okay, and for kidney or liver, and you know that okay, this is coming positive, this is coming positive, okay, I know that this is my case, and this is coming negative, I know that this is the diagnosis, okay. But sometimes what happens is that they will not give you the entire spectrum, so they'll give you some and they will not give you some, right? Especially in kidney, I've seen that. Sometimes you might expect them to give you all more stains, but they will just give you two, and then they will give you the other workup, like the IF and the electron microscopy. Okay, so sometimes they become confusing, so know each stain for liver and for kidney, and for each entity that you're studying, you should know what you're expecting on that stain. Okay, so be very thorough with these so that you don't have to take too much time at the exam time to think about what it would be, what it can be, etc., right? And sometimes they get confusing when you're seeing them for the first time in the exam. It might get confusing, so like I said, for the IHC sometimes the control helps. Okay, so you can go to the control part of the slide and then you can just take a hint from it, but try not to rely on that. Try to be thorough with the special stains even before that, right? And like I said, you may not get, you may get the entire spectrum, but you may not get it at times. You may just get one or two slides and that's it. So you have to know each stain and what it means, and what hint that is giving you. Okay, so together they are going to give you the diagnosis. Your history also plays a very important role in this long cases, but along with that the special stains are very important, right? So together you have to understand and think what your answer would be. So you need to know your special stains very properly. Now if you know them already, you're thorough with them, fine. If you don't, this is the time to prepare. That's all. Okay, you need to know yourself. Do I know it or not? If I don't know it, I have to work on it. That's it. Again, IF picks and slides, something which you cannot miss before going to the exam. You are going to get it because, as I said, 90% of the times you will have a kidney slide, and that kidney slide or the kidney case would have an IF pictures or IF slides. So what happens is that here they have usually IHCs. For IF immunofluorescence, they have alternatives IHCs, so you might have those IHC slides or you might have the immunofluorescence pictures. Okay, so they'll give you big pictures, and in that pictures again they might not show you the entire thing. Okay, so you might be relying on seeing the entire thing for basing your diagnosis. So you want to see a full house and then you want to call it lupus, but you're not, they will give you only two or three, so you don't know what the rest are and you don't know if they're positive or negative, and you don't know what to call it then. So don't rely completely on things that we do for say multiple choice questions, right? That's a different thing of preparing, but here you're just getting, you might not get the entire thing in front of you, but still you have to come to the diagnosis. So of course there would be hints in those slides as well, but what I'm trying to say is, yeah, you should know them in and out, right? You should know them in order, you should not be lost, because these are things we at least what I did was I tried to kind of memorize a lot of them, because I'm not so familiar with medical kidney and medical liver. I have not seen them for the majority of my pathology learning. I've not done them, so then it becomes more confusing, right? If you don't know and if you're not very confident with each one of the slides and each one of the pictures, right? So yeah, this is something, if you're not familiar with, if you're like me, then you have to give more time to it. Same thing with electron microscopy. Now there will not be too many findings for electron microscopy, but you need to know the basics, right? You need to know what you're seeing, where you're seeing, and how to describe it in your paper, because again, this will not be a viva, so whatever you write is what the examiner will think that you know. So you need to write as much as you can, but you have only 20 minutes to do everything together. So at least know, at least give, know, prepare yourself so well that you don't have to give too much time in understanding and racking your brain at that time only for just to find out the findings of those pictures, right? So if you're familiar with those, then you can save time on the writing part. right? You're fast in seeing your slide and the IHCs, and you know how to interpret them, and you have read the history carefully, and you quickly see the IF pictures and EM, you know exactly what you're trying to find in those, and then you will get the answer, and then you can write down your answer you will get more time to write your answer then. Okay, so know yourself and know if you're able to interpret all this, and if you are not very confident in any of these, give it time. Okay, just go through whatever you can as resources, and make yourself perfect in it, right? Now, as I said, writing part is important because that's what the examiner will think that you know. Now you have to put in as much as you can, and this is a long case, so they want you to write more than what you wrote for your short cases. So if you write 1 page for your short, then you at least should write 2.5 pages for your long cases. So for that, you will need time. So you have to time your practices also, and you need to know the points which you have to include, right? For an EM picture, you need to know what things I have to write down, right? For an IF picture, you need to know what terminologies I have to use, right? So those things are important when you're preparing for your long cases. Okay, like I said, medical kidney, medical liver, now these are the areas that will need more attention, because as I am assuming that not all of us are very familiar with it, and we are not seeing it on a daily basis. Those are specialized kind of areas, right? So what you can do is you can listen to lectures, or how much, I mean, on YouTube or wherever you have available, wherever you find it available, but make notes and revise and memorize them, so in a way that you have an algorithm in your mind, right? In a way that you have an algorithm, you are going to see this, and then you're going to see this, and then this. So you're going to look for this point, and if all those are present, then you're going to call this. You're going to look for this points. If it is not there, you're going to say this. If it is there, you're going to say that. So kind of make an algorithm in your mind, because it will, I don't know, I think it might help. So if you find a way or a method or which you find more comfortable with, it's up to you, right? But this is just what I'm suggesting, because that's what I found easy and helpful, basically, right? uh, as I said, you may want to listen to lectures, because a lot of the times the lectures, when you are listening to different speakers, they give you their own perspectives, and when you listen to the multiple perspectives, then everything becomes very clear to you, right? So I find that very interesting to listen to different speakers, and I so many times I just go back to the basics of listening to them. So they start to explain from right from this basic anatomy, basic histology until the end. So that really helps. And whenever I'm listening to these, I start making notes. So for medical kidney and medical liver, I really, really, really recommend you to write notes. I can make these notes very, very small, maybe 2 pages for each of them, 2 pages kidney, 2 pages liver, but have them with you, and revise them as much as you can, so that all the entities that are exam favorites, you know them, and you know what their findings are. Okay, and you know what to write. Okay, now if it is possible for you, you should see slides, because that will help you, and know the scope for the exam. So like I said, not everything will come in the exam for kidney and liver cases, but the more important ones, they are the ones that you should be very familiar with. And in case of kidney, those cases, you have to know what the IF findings are, and you have to know what the EM findings are, and how they look like. You have to memorize or familiarize yourself with how they look like. Okay, so if you're preparing yourself for this exam, you have to do this much. You have to know what cases are common in kidney and what cases are common in liver, and only the common cases will come in the exam as well, for these two sections at least, right? Medical liver and medical kidney, you cannot have a very rare thing in the exam coming. It won't be, uh, unless it is something like I don't know, maybe a very classical feature on the IF or EM, something like that, maybe. But otherwise, I don't think so. It's not fair that they ask a very, because it's already a specialized area, and they cannot ask you a very, very rare question. They it's just like you know how to see, or the basics of kidney and liver cases, right? That's what they are expecting, I believe. So know the scope, and you don't have to go to very rare things, right? But you need to know what the common things are, right? And along with that, you also need to know the LFTs, because that will be there in the exam, so you can correlate with them for your sake as well. And for the kidney as well, again, you need to know the the renal function test, how it correlates with their findings, and how it is, and how you're going to, what are you going to expect to see in the slides, etc. Because the case histories would be very elaborate. Okay, they would include everything, and sometimes if you go through the entire case history, you might just come to the answer. Like for the first time that I gave my exam in the kidney, for the kidney case, everything suggested that it was a diabetic glomerular sclerosis. Everything was given. He was a diabetic since a long time, and everything was given already. And then when you see the slide, you start to see all the features, and then you just go and see your special stain, and you see, oh, okay, this is the past stain, this is what you're expecting, and this is how it has come. So yeah, and you know the answer in a minute, right? So you don't spend your time. So like I said, in long cases, sometimes it is that easy. Everything is so straightforward. The case history is right there in front of you. The special stains are showing the exact thing what you want to see, and everything is just clear, and you have a straightforward answer. But sometimes, like the second exam which I gave, the diagnosis was just not straightforward. There were only two special stains, and it was a very confusing case. There were a lot of things given in the history which pointed to something or the other, and there were crescents also, and there were too many things going on in the slides, and there was just it was a very difficult case, I would say. Okay, so you might be lucky to get a very straightforward case. You might not be so lucky. So, but you have to prepare yourself for both of the situations, right? But in general, the scope of the exam, that means the cases that they'll ask you, will be the ones that are commonly seen in daily practice as well. All right. Now, as I said, and I repeated myself, you need to have some bullet points in your mind for writing. Okay, so you need to know, if you're writing a kidney case, what all things you're going to see, and the algorithm. Okay, like they should know that you went this way in a systematic manner. Okay, so you saw this first, you saw the glomeruli, and you saw everything inside the glomeruli. Then you went out, and then you saw the tubules, and then you saw what was in them and what was around them, and then what was in the interstitium, and then you went to the vessels, and you saw the vessels, and you describe them, and you are describing the negative findings and the positive findings, and then you are concluding, okay, this is the findings, and then you go to the special stains, then you go to the IF, and then you go to the EM, and then in the EM, what are you seeing, right? Everything you're doing it in a systematic manner, and then you're finally writing your diagnosis. Okay, so they would want you to write in an algorithmic manner, but at that time it is really difficult. I mean, it is a waste of time to keep thinking and writing at that time. So it is much easier to have some bullet points in your mind that you're going to go this way for kidney and for liver, both of them. And when you know that these two cases have high probability of coming in the exam, why not prepare for it? When you know the exam question already, why not prepare for it, right? So yeah, just prepare for it. Now for me, this is the Telegram channel, OTPPGP, and was one of the most talked messages to do, and this was I don't remember which number talk it was, but these two were very, very helpful for me. I am not sure if how you can have access to this again, but if you can, by any means, maybe you can write to them, or I don't know how, then these are the best lectures, according to me, in my experience, to get the basics clear for the liver biopsy and for the kidney biopsy, right? So absolutely amazing lectures, and I have listened to them multiple times during my studies, and they have really, really, really been very helpful. Okay, so there are approach to liver biopsy and kidney biopsies got two parts. It's in two parts. So those three lectures were really helpful, and I don't know if you want to go to the Telegram app and go to this channel and find out some messages, and if you can somehow mail to the admin or somehow get this talk for yourself, then please do it. Okay, because I think that these are the best. But apart from that, if you don't have it, I'm sure there will be a lot of basic lectures on YouTube as well, right? Now for the exam day, you need to write much more than any other section, right? Because it's the most marks, 20 marks for each case, so you have to write as much. Now each case also has 20 minutes, and you might think at the first answer that it's a lot of time, but you have to see so many things, you have to think of so many things, you have to read the history, which is so big. Everything will take time, and it will not be enough. So you still have to be quick, right? You still have to be quick. Now you can expect sometimes rare and uncommon stuff, like I said, IgD positive and LPHL. I mean, I don't know, I've never seen that case before, nor was I expecting that, right? IHD positive and LPHL. So those kind of cases, sometimes a rare uncommon stuff can come up. Sometimes you might get two diagnoses. Those things, yeah, can happen here. So you just be prepared for everything, right? And sometimes, as I said, that it might be so straightforward. Like you know everything about it. Yeah, you know everything like glomerular, diabetic glomerulosclerosis. Everything is right there in front of you. You don't have to think twice. So it's all possible in this section. Like for many sections, I say there may be more than one answer for diagnosis. If there are, then you need to write both, right? Now you should not, you cannot, meaning you should not try to give a DD because everything is in front of you, the entire workup, right? In short cases, sometimes you don't have the workup. You say that okay, if I have the IHC, I'm going to see it and then I'm going to comment on it. But here you have the entire IHC, you have everything there, so you should not give a DD. You should give your answer here. But unless that is the only thing you can do, meaning like I got the exam IHD positive and LPHL, which was something very unique, very unexpected. I had not seen it, not known it, so that time, and it was very confusing. And time is running out. So you write the entire thing and then you give a DD. Okay, I did not know what to. I did not know any better, right? So I had to give a DD between whatever I thought at that time. Now, I really hope that it doesn't come to that for anybody, and you're able to understand and see and find the correct findings. And I hope that it clicks in your mind the correct answer, and you are able to give the correct answer. Okay, so just try to understand it in a way that you know the answer is right here. It's in front of me. Just look at the case in that way, that the answer is right in front of me, everything is right in front of me. And yeah, so this is not the time that they're tricking you for anything else, but this is the time that they actually want you to come to the diagnosis. That's all. You do not have to come to a DD, but you have to come to the diagnosis. You have to tell them that you know how to interpret these slides and you know how to come to the diagnosis. So just try to do that, right? All the best for that. Yeah, so there will be many slides, there will be multiple slides. There'll be IHC, there'll be HNE, there'll be so many things out there. So do not miss out on the interpretation, because if you have seen it and you've not written it, the examiner doesn't know. So whatever you write is what the examiner thinks that you you have seen. So make sure that you tell the examiner, yes, that I have seen this. Okay, even if it is one line, even if it is not a very properly written answer, just write down about all the slides that are present or all the pictures that they have given you. You cannot tell them that yeah that they gave you this particular picture or a particular slide and you were careless enough to not see it. Okay, even if you get the diagnosis correct, you have to tell them that I saw all the slides. So just write down about each one of them. Okay, about each slide, whatever you think, positive, negative, just write one word, but do write it. Do not miss out on the interpretation, especially in the writing part. Okay, and also when you're seeing and you're making a diagnosis, you should not miss out on anything, of course. Now remember, when interpreting the IHC, all slides will have a bit of controlled issue. So if you are lost, if you're not getting, if you forgot maybe the interpretation or where you should see the positivity, etc., you can use it for your help. If you are stuck, history may be helpful because it is a long history. There will be a lot of things inside. Okay, so for example, we got a case of colectomy, post colectomy, and the patient had something, and it was a liver case. So what you had to do was that you had to correlate, and I was not able to get the answer, but then the end moment I realized, okay, so colectomy was done basically because of IBD, and this case was there, PSC. So all those things, they come together then in the end. So history is the link, and you will invariably get hints from the history in long cases, because there are so much information on the paper. Okay, so you will definitely get something out of it. So just read it again, read it, try to get hints from it. Yeah, go to the slide and go back to the history again, do all that, but your main aim is to just come to the correct diagnosis, right? Come to one diagnosis, right, which is fitting into everything, which is fitting to your history, fitting to all your slides that are given, fitting to the morphology, fitting to everything. Okay, you will mostly get the answer correct because everything is right in front of you. And like I said, most of the times, especially for my first exam that I gave, all 4 cases were extremely straightforward, and there was no need for a differential at all. Okay, and usually it will not be needed or required, but unless once in a while if you get a very rare case or something which you are very confused, like I said about myself, IgD positive and the patient. So in that case, if you are, maybe you have no other choice, you're not sure if it is what is it, so you can write in a differential manner. But again, if all your interpretation is correct, and if you have written everything correct, they might give you marks on it, right? Which I think probably happened with me as well. That's why I cleared it. No, there's no viva, like I said, so you need to put all your thought process, whatever you thought, whatever was your algorithm. If you're seeing a kidney or a liver case, you went systematically, you have to put all that in your writing. So what they're going to see is how you have approached the case and how you're writing it. Okay, so that means how you are seeing it, how you are seeing things. And so you saw the HNE first, then you saw this is this, and you saw the main findings of HNE, and then you went to the IHC, and then you saw this is this, and then you are interpreting it as this and this. So you're writing everything, and then you're concluding to something. So all that has to come into your writing, because there's no viva. You have to explain it in your words, written words, right? So be good with it. All right. Now, probably we'll finish it over here, and we will continue from the rest of the sections. I think there are 3 more or 4 more. We will do it the next time. Okay. Thank you so much, and I really hope that you guys are finding this helpful. I have got a lot of feedbacks, good ones, which I'm really thankful to you guys for. Thank you for your kind words, and I'll continue to make lectures. So I have got a suggestion to make a video regarding the making of a CV for a histopathologist. I will surely do that. I will definitely work on it and do that. So, but first we'll finish this exam thing, and then we will do the rest of it. Okay. So for everybody who's preparing, all the best, and for everybody who's listening to my videos, if you like them, please let me know. And if you think that I said something wrong, or I don't know, which you don't agree with me, you're most welcome to comment on that. And if if you feel like this was useful, then if you feel like you can share it with somebody, please do so, on groups, or on to friends, or to whoever you think is preparing for this exam. And just a big thank you to all of you, and I'll see you soon. Bye bye.